Welcome everyone to our webinar, Data at Your Fingertips, Improving Interoperability, HIE and Direct Messaging. Hybrid Solutions is Georgia's Health IT Center, assisting clinicians across the state of Georgia to promote interoperability through the successful use of EHR technology. We partner with various healthcare systems across the state of Georgia, DCH, Georgia Health Information Network, and many other community and professional partnerships. We are located at Morehouse School of Medicine, National Center for Primary Care. Our executive director is Carmen Hughes, and our executive medical director is Dr. Dominic Mack. My name is Brianna Greer, and I am the program coordinator here at Hybrid Solutions. And today's presenters are as follows: Kathy Cameron, lead business consultant at Health Catalyst, and Rudy Snyder, health IT consultant at Hybrid Solutions. Today's webinar objectives are to review the use of Health Information Exchange, HIE, understand the benefits of utilizing both HIE and direct messaging to better exchange health data, and also to view a direct messaging demonstration. Thank you so much for bearing with me today, and I will go ahead and turn it over to Rudy.
Oh, well, thank you, Brianna. I appreciate it. Thank you for inviting me here today to talk about health information exchanges and to let you know more about Hybrid. I ask, please, that you're nice to me today because I did have my COVID-19 shot yesterday. And if I do have any side effects, for instance, if I faint or my connection goes quiet, somebody please call the doctor, okay? Anyways. Back in 2009, the Office of the National Coordinator for Health Information Technology encouraged healthcare to move away from paper charts by paying incentive payments to use electronic health records in meaningful use. Well, now ONC is encouraging the exchange of clinical data through their Promoting Interoperability program and through other regulations such as the 21st Century Cures Act and the Patient Access and Interoperability Final Rules. ONC, had a plan at first to create structured patient data that healthcare could share between settings of care to coordinate care between the patients. Meaningful Use did this by standardizing the way that EHR vendors developed and certified their applications, stressing the inclusion of data important to treating patients. Meaningful Use even included some elements of interoperability initially with the use of e-prescribing and sharing of summaries of care between referrals. If we look at e-prescribing, for example, according to a recent SureScript study, it's led to cost savings of between $140 to $240 billion and result in better health outcomes over the next 10 to 15 years. So just by enabling prescriptions to get to pharmacies, it has resulted in a 10% increase in patients getting the medicine they need. And reducing manual misreading of prescriptions, a major cause of mistakes for patients getting the wrong medication or dosage, has been greatly reduced by using e-prescribing. In the United States alone, more than 4.5 million visits to an emergency room happen due to avoidable adverse drug mishaps each year. With e-prescribing, many of these mishaps are being eliminated as technology monitors patients for possible medication interactions and medication allergies. Now we're in the next evolution in ONC's vision for healthcare technology, and that is to share clinical data between healthcare entities. Local and regional health information exchanges were set up to exchange clinical data quickly between healthcare facilities to coordinate care between settings of care. And also, national health networks were formed to share clinical data across the nation. Treating diseases such as heart disease, cancer, respiratory disease, diabetes, and other chronic diseases require multiple clinicians and settings of care. Without being able to get clinical data from the multiple clinicians and settings of care, a clinician may not have the best information that they need to treat a patient. However, using health information exchanges, they are able to interface with EHRs and query for patient data from other settings of care. This way, a clinician can better treat their patients and get better outcomes. Most health information exchanges consist of direct messaging, query-based exchange, and patient matching capability. Direct messaging enables hospitals, clinics, and practices to push clinical data to other settings of care in the form of secure email. The Georgia Health Information Network has a product called Georgia Direct that they provide for free to Georgia clinics. And Kathy will be telling you more about Georgia Direct and how it works. Query-based exchange enables a healthcare worker either through the EHR or through a web browser, through our portal, to look up clinical data for patients. And patient matching capabilities uses demographics of the patient to match demographics of patients at other settings of care so that these encounters and data can be combined and displayed to the healthcare worker. So how does the HIE Health Information Exchange fit into the vast health information network set up in the United States? HIE is one of 4 regional HIEs connected to the Georgia Health Information Network, which is called GHIN. GHIN is state funded to enable Georgia health systems to connect to other health systems, clinics, and practices. HIE is the only HIE in Georgia, however, that is not regionally constrained and can sign up any clinic, practice, health system, or other healthcare entity that needs to connect to Georgia's network. Currently, we're chartered to serve smaller independent practices, small independent hospitals, rural communities, underserved communities, and those communities that have greater need. Through the use of available grants, we're able to reduce the cost needed to connect those in need to our network. Our platform enables us to connect to any EHR system using healthcare standards and protocols. Many EHRs are certified using these standards that make connecting their data to an HIE possible. Our technical team is well-versed on using these standards to make connections to different EHRs. So when you subscribe to us, we will work with your EHR vendors to make the connections and get the data where it fits your workflow. Our technology partners consist of NextGen, Tango Squared, and Amazon Web Services to enable HIE to deliver HIE services to you. NextGen develops and maintains our HIE platform called Health Data Hub and provides the query-based exchange and patient matching capability. Tango Squared administers the platform on a daily basis, and they provide help desk support to our clients. They also make the connections and test that the data is correctly flowing to connect to your EHR. Amazon Web Services, and y'all have heard of Amazon, obviously, is where our HIE is hosted, and they provide us scalability, redundancy, and disaster recovery for our platform. I need to point out that we are an unbiased entity and are not sponsored by any hospital, clinical system, or EHR. Therefore, we work to provide you with a connection that gets you all the clinical data that is available through our connected health information network. So let's see, speaking of our health information network, here's a big picture vision of what the Georgia Health Information Network, or GHIN, can do for you. Again, as a regional HIE, HIE is connected to GHIN. Therefore, our clients have access and can share clinical data with health systems, hospitals, payer organizations, other healthcare facilities, and other clinicians. Current and potential services include connecting to pharmacies for patient medication and medication allergy data, connecting to laboratories and diagnostic imaging services to order and receive results, connecting to patients for patient-generated data, connecting to public health or other agencies for reporting purposes, and connecting to registries to submit data. These type of services will only increase as developers come up with new ways to use the network to improve healthcare. As an example, we have a client named SensorMed that wants to use our HIE to upload patient data from devices that they provide to patients to help with chronic care management. Working with clinicians, SensorMed helps the clinician monitor the patient-generated data to better help their patients. SensorMed then also helps the clinicians identify the proper codes that they need to use so they can get paid for working with the patients remotely. And then to even get bigger picture, the Georgia Health Information Network is connected to other HIEs in South Carolina, Tennessee, Alabama, North Carolina, and other states. They're also connected to eHealth Exchange, which is connected to the Veterans Administration, the Department of Defense, and other national networks. So when we look at HiBridge HIE as joined to GHIN, we have an HIE that acts as a conduit between different practices, hospitals, government agencies, and also correctional care facilities. We provide medication allergy data through a service from Dr. First. We have plans to develop connections to EMS services so they can have patient data during an emergency. Most of the time, healthcare is delivered locally in different settings of care. Unless the different settings of care belong to the same health system, though, they may have problems working with each other since they may not be able to share data. HiBridge enables even those settings of care that have different EHRs to share clinical data and collaborate on patient care. In cases where care is not delivered locally, the connection to GHIN and eHealth Exchange enable our clients to query other states and health systems for a patient's clinical data. Here's a current list of HiBridge's main core products and services. First, we have electronic access to aggregated patient information, and that consists of having a repository of all patients' data for all HiBridge clients. This enables our clients to search our repository first for any clinical data for their patients. Since we run as a repository for all our clients' patient data, there is no load on our client systems when queries are run to get data for their patients. Any queries from other settings of care, either from our other clients or from the connection at GHIN, they're directed to our repository to access the clinical data. We have a connection to GHIN where we can also query data from GHIN's clients, other HIEs, and even to national networks to find patient data. GHIN can also provide practices with a free Georgia Direct account to send direct messages and push clinical documents to other settings of care and agencies with secure email accounts. HiBridge also provides medication reconciliation through Dr. First for any patient queries for our clients. With this data available from pharmacies, healthcare workers are able to see the actual medications that are prescribed and used by patients along with their medication allergies. These are some of the optional products and services that are available or are being developed for future demand. If lab and radiology orders and results aren't visible in your EHR as a result of our connection, we may need to do some more development work with your EHR vendor. However, even if the results aren't visible in your EHR, the results would be visible in the portal or the web browser. There are other GHIN services that we could provide you too, such as immunization or syndromic surveillance reporting. However, at this time, syndromic surveillance is not reportable for ambulatory practices, but immunizations are and can be used to satisfy measures on the public health objective in the Promoting Interoperability program. Most data is available through all connections from GHIN. However, if you have any specific questions about whether data can be obtained from another HIE or a connection, we can investigate that for you and determine if additional connectivity services are necessary to get the data to you. Just to kind of illustrate at least the direction that they're going with the Promoting Interoperability program, this is a couple of objectives for both the Medicaid and the Medicare MIPS programs. And these require you to have an HIE to, in essence, meet the requirements. In both cases, it involves the ability to send and receive summary of care documents between providers that are referring patients. Usually, these are primary care providers that are referring their patients to specialists, but they can be new patients or patients that have visited different settings of care since their last appointment. So either the summary of care records can be sent using direct messaging or using a bidirectional query exchange system. So what are the benefits to connecting to an HIE, and specifically HiBridge's HIE? Well, you can query for a patient's clinical record from any connected health system, clinic, provider, or agency that is connected in some way to GHIN. This enables you to have up-to-date records for your patients. You will know if your patients have visited other settings of care since you last saw them and what treatments they may have received. You can better understand your patient's complete medical history. With medication allergy information, you'll know what medications they've been using and what medications they are allergic to. This can help prevent medication interactions for new prescriptions your patients may need. Since an HIE enables clinicians to see testing and treatments tried by other clinicians, it may help you avoid repeating the same tests and treatments. This all means that by sharing information about a patient, the patient's care can be coordinated between many clinicians. It also helps primary care providers get feedback and understand the treatments given to their patients by specialists they may refer their patients to. Patient safety is improved by reducing medication and medical errors, and an HIE can provide reports to public health agencies and registries, helping to improve population health for everyone. And because you may no longer have to call other clinician offices for patient charts, it saves on phone calls, faxing, and paperwork, getting those charts from other clinicians. Here's a list of organizations that are directly connected to GHIN and thus connected to HIBridge. These connections provide access to many state and federal agencies, multiple health systems throughout Georgia, other HIEs, payers, and specialty groups. There may be multiple hospitals, practices, clinics, and other settings of care that connect through each one of these organizations. So in all, these connected organizations may represent thousands of clinicians that can share clinical data. Just to give you an idea of what it would cost for a practice of less than 10 clinicians to join HIBridge, here's a chart showing the activation, connection costs, and the annual subscription fees for a 3-year contract. The activation fee would be a one-time fee of $4,500, and then there would be annual fees of $2,700 for query-based exchange and medication service from Dr. First. Now, there might be additional charges from your EHR vendor to establish and test the connection. So if we look at the total from HIBridge, it would be roughly around $12,600 for a 3-year commitment. However, there are available grants to reduce and in some cases eliminate the activation fee and the first year fee. Subsequent years depend on additional grants being available. The goal of our HIE is to provide you with a service that will enable you to improve your patient care. So we want you to have the information that you need to design the proper treatment for your patients and avoid any unnecessary costs. By understanding the total treatment process and history for your patients, you could have information that leads you to better treatments, medications, and solutions for your patients. We want more practices and settings of care to join an HIE, whether it's our HIE or someone else's, to improve healthcare. If you're interested in subscribing to HIBridge, or if you want to set up a meeting to talk more about your situation, please contact me by either emailing or calling me. And then I'd be happy to set up a virtual meeting with your team to discuss your needs. And I believe we're going to have a slide towards the end that will actually have my email address as well as my phone number. Well, at this time, this is all I've got. And I'd like to go ahead and turn it over to Kathy Cameron from Health Catalyst so she can tell you all about Georgia Direct.
Thank you, Rudy, and thanks, Brianna, for having me today. Like they said, my name is Kathy Cameron. I work with Health Catalyst, who is the technology vendor for Georgia HIE for the direct messaging. So today what we're going to talk about is the clinical messaging service that we do provide through Georgia Direct. What is Georgia Direct? Georgia Direct is a trusted, secure email messaging service that allows providers to send and receive authenticated and encrypted patient health information over the internet to and from other authorized and trusted recipients. That this could be both within Georgia and nationwide. Georgia Health Information Network offers Georgia Direct at no charge to authorized credentialed providers. You are able to attach documents to Georgia Direct, the emails that you send. It's simple to implement and very, very easy to use. Right now, we have over 5,700 addresses for physicians and staff in the state of Georgia. And last year, we did over 900,000 transactions, and that are messages coming to and from those addresses that we have. Georgia Direct enables an environment in which all messages sent from and received by that address can be protected and processed in accordance with Direct Trust and HIPAA rules. Once you sign up for Georgia Direct, you are issued a domain, for your facility. It's your own unique domain. Once that is established, you're able to provide direct addresses for your staff. That includes physicians, nurses, assistants, front office staff, billers who may need some additional information to bill for the services. So you're able to control who has those direct addresses. Using Georgia Direct, providers will have more timely and effective communications between each other, and this can lower costs and improve patient quality. So you eliminate costs, not only monetary costs, but also the time spent making phone calls, waiting for callbacks, sending faxes, waiting to receive faxes, and using different mail services to send these documents. So these documents can include referrals, patient summaries, PT notes, discharge summaries, continuity of care documents, etc. All that can be attached to the email. Clinical messaging or Georgia Direct is simply an email service on the front end. What you look at is an inbox. So there's very minimal training to get started with Georgia Direct. This is a shot of the inbox. It looks like most emails that you use. You will have your different folders. You'll have filters where you can push emails into those folders. You are able to create a contact list. You can create a signature. And one thing about Georgia Direct is that you can delegate someone in your organization to have access to your email. So for instance, if you're going on a great 2-week vacation, a cruise, you do not want to be bothered with referrals, you can delegate someone to have access to get your email so nothing goes by the wayside while you're gone. When you use Georgia Direct, you are able to communicate to and from other providers who also have a direct trusted email. So you were not able to send or receive from an Outlook or Yahoo or Gmail, only with other trusted addresses. We do provide a robust provider directory for you to be able to look up those addresses to create your contact list. This directory includes not only Georgia Direct, people who are using Georgia Direct addresses, but if they have other addresses through their EMRs. So for instance, if someone you need to communicate with has Athena Health, Athena does use Direct Trust for their direct addresses. So you can send to their Athena Health direct address. We do work in accordance with Direct Trust. Direct Trust is an agency that was developed to help grow the direct exchange of PHI over the internet. It operates under an agreement with the ONC, and each member must be certified to be able to use and say they are part of the Direct Trust. We use the standards that are set forth by them to make sure that the email is safe and secure. If you want more information on Direct Trust, their website is www.directtrust.org. Okay, so as I said earlier, if you know someone, need to communicate with someone who does not have a direct address through Georgia Direct, but they do have it through their EMR vendor, then you more than likely will be able to connect with them. So this is just a sampling of the systems that do use Direct Trust. So if you yourself has, say, eClinicalWorks, then eClinicalWorks can provide a secure address for you. If not, if you do not have one of the vendors that do provide it, then as I said, Georgia Direct will provide that address free of charge for you to use. So in conclusion, really, what is the most important thing to know about Georgia Direct is that it is just like an email with an added layer of security and trust and identity operating behind the scenes. This makes direct exchange of messages and attachments suitable for electronic sharing of personal health information, which HIPAA requires must remain private and confidential at all times. Widespread participation in services like Georgia Direct or your EMR Direct Trust email enables providers to easily and securely exchange patient health information using trusted email that is irrespective of organizational or vendor boundaries to meet meaningful use, exchange requirements, and overall care coordination. Thank you, Brianna.
Oh, you're welcome. Thank you so much, Kathy and Rudy. Okay, so we're going to go ahead and move on to the question section of the presentation. If there are any questions, please feel free to place them in the Q&A box right now or in the chat if you feel more comfortable utilizing the chat. I'm going to go ahead and get started with one question that we did receive in our registration that I would like to address. So the first question that we have here is, can health departments use HIE to find missing demographic and contact info on patients testing positive for COVID-19?
Okay, well, this is Rudy. Let me answer that, I guess. We actually have a project with the Office of the National Coordinator who's going through GHIN to actually gather COVID-19 data. And using e-case reporting, that data coming through us, either a one-directional or a bi-directional connection, we can then send that data over to public health, and that would satisfy the report demands.
Thanks so much, Rudy. Okay, we're going to give it a moment or two for anyone else who would like to place any questions in the Q&A box or in the chat box. Kathy, are there any additional tips that you would like to provide, or Rudy, regarding the HIE or the direct messaging?
This is Kathy. Yes, so if you're interested in the Georgia Direct Messaging, then you would contact myself or Benita Bowers, who works there with GHIN, and we would get you started. There is some upfront paperwork that does need to be completed. Direct Trust does require that every application be verified by a third-party vendor. We use a vendor called named DigiCert. So we do send your application to DigiCert. They do verify that your entity, your organization does exist, and that the contact person that you have on file, is a person. And once they verify that, it usually takes just a few days for us to get that domain created for you, and then we will reach out to get who needs addresses and to provide information for training to get started on.
Okay.
Awesome.
And also, if you want to learn more about HiBridge's HIE, feel free to contact me, email me, or call me, either way. Also, you can contact HiBridge Solutions, and they'll get the referral to me. But we do have a process. We can demonstrate at least the portal view for you. We may not be able to demonstrate the integration in your EHR, because a lot of that comes from your EHR vendor. So, you could probably ask them a little bit about, what kind of workflow they've designed in the EHR, given the health information exchange is connected. But we can show you the portal view, show you clinical data that can come through your web browser, and even how you can take the CCDs if needed and go ahead and import that into your EHR. So just contact me if you got any questions, and we can get together, set up a meeting, and get you well on your way to interoperability.
Awesome. So we actually do have a question in the chat box, and hopefully we can get an answer for it. Okay, so someone says, or Ralph says, how can health departments that how can health departments that their info on individuals, not aggregate data? Georgia has 64,000 COVID cases with unknown race. Fulton County cannot do contact tracing for about 8% of its COVID cases because of the lack of phone numbers. So I guess, how can health departments maybe receive that data? I don't know if you want to take a stab at it, Rudy.
Yeah, I guess I'm not real clear. I guess because we have the bidirectional or the one directional connections, we can send any data as requested by the health departments. And usually that's based on codes. Now, the demographic information may not be able to be sent, because of privacy issues, but I guess we'd have to look at the demographics to understand how we could group that in order to give, specific information about race and so forth.
Right. And if there are any additional questions, Kathy and Rudy's contact information will be up on the slides in a moment. So if you have any questions, feel free to reach out should you have any questions. Okay, that is the last question that I see here. We're gonna go ahead and move on. So today we have, Hybrid Solutions has a really wonderful continuing education or certified continuing education and professional development opportunity through Format Approved. Today's featured class is Certificate of HIPAA Proficiency for all healthcare staff. In this class, it'll provide HIPAA basics, understanding of HIPAA privacy rules and security rules, regulations for business associates, and summarize HIPAA documentation and training. To sign up for this class or to just visit our landing page with Format Approved, you can go to www.formedtrainingcenter.com/hybrid solutions. If you would like to sign up for this class or any of the classes on our landing page, please use HIBridge20 to receive a 20% discount. Again, that's HIBridge20 to receive a 20% discount. So here's the contact information for Rudy Snyder. I'm going to go ahead and just wait for a moment so you can kind of get that down. That's R. Snyder at hibridges.org. Phone number being 678-372-6048 for our listeners. And also email info@hibridgehie.org. We also have Kathy's contact information here, Kathy Cameron, phone number being 601-201-4377. And her email is Kathy, CATHEY, Cameron @healthcatalyst.com. Here are some of our resources here. So I'll just give this a moment as well. Should you need any of these websites. So I just want to extend a huge thank you to everyone that joined us today. Thank you so much, Rudy and Kathy, for all that wonderful information. Please be reminded that Hybrid Solutions has a monthly webinar every third Tuesday of each month from 12 p.m. to 1 p.m. Eastern Standard Time. Please save the date for our next webinar next month in April on April 20th, 2021. Again, thank you all so much for joining us, and I hope you have a wonderful afternoon.